Hello, my name is Keaton Peterson. This presentation is about substance use disorder, treatment, aftercare, and relapse. Substance use disorder is not simply a lack of discipline or poor choices. Changes in the brain can reduce a person's ability to control substance use. Effective treatment requires support, therapy, and sometimes medication. Adolescents and young adults are more vulnerable because their brains are still developing. Early intervention and open communication improve outcomes. Substance use disorder is a medical condition and not caused by family failure. Families should focus on support rather than blame. Professional help is often necessary for recovery. Caregivers should also practice self-care and seek support for themselves. Treatment for substance use disorder is individualized. It may include therapy, medication, and behavioral support. Treatment often includes detox therapy and long-term recovery support. Family involvement improves long-term outcomes. Treatment often begins with an assessment to understand medical and mental health needs. In residential settings, individuals receive structured care and daily therapy. Outpatient programs allow individuals to live at home while receiving treatment. Care teams work together to support recovery and aftercare planning. Counseling focuses on identifying patterns, triggers, and recovery goals. Individuals learn skills to manage cravings and cope with stress. Therapists use evidence-based approaches such as cognitive behavioral therapy. Family counseling improves communication and support systems. Support groups provide connection and shared experience. Sponsors offer guidance and accountability. Regular meetings help build structure and reinforce healthy habits. Ongoing participation improves long-term recovery outcomes. Aftercare begins after treatment and supports long-term recovery. It may include therapy, support groups, and medication management. Structured environments can provide accountability and stability. Aftercare focuses on preventing relapse and building long-term goals. Early recovery focuses on stabilization and managing cravings. The next stage builds routines and coping skills. Long-term recovery focuses on maintaining healthy habits and relationships. Recovery is ongoing and not always linear. Relapse is common and reflects the chronic nature of substance use disorder. It is not a failure, but part of the recovery process. Triggers and stress can increase risk. Support and treatment adjustments reduce future risk. Relapse often begins with emotional changes, such as irritability or withdrawal. Mental warning signs include cravings and risky thinking patterns. Physical relapse involves returning to substance use. Early support can prevent a full return to use. Prevention is one of the most effective strategies. Education increases awareness of risks. Early intervention improves outcomes. Reducing stigma helps individuals seek support. Recovery is possible with the right care. Families can support teen mothers by showing empathy and avoiding blame. Providing structure and practical support helps them stay engaged in treatment. Encouraging counseling and peer support improves outcomes. Families should prepare for relapse by recognizing warning signs. If relapse occurs, respond calmly and prioritize safety. Encourage immediate return to treatment and support systems. A pre-plan is a strategy created in advance to support recovery. For example, if you feel triggered or begin thinking about substance use, you agree to tell me or your sponsor right away. A plan provides clear steps to follow if a relapse occurs. For example, if a relapse happens, we will stay calm and make sure you are safe. Next, we will contact your therapist, sponsor, or treatment provider right away. Then we will help you re-engage in treatment or attend a support meeting within 24 hours. These steps help reduce harm and support a return to recovery. Families should adjust boundaries to support recovery. This may include structure, accountability, and clear expectations. Support should remain consistent and non-judgmental. Thank you for listening to this presentation on substance use disorder treatment and recovery.